All right, so the next thing we're going to talk about is contraception. We've talked about getting pregnant. Now we want to talk about not getting pregnant. This is going to be a really brief bit about assessment for contraception, because we want to help our patient assess what is the best contraceptive method for them. And then the rest of the sections will be about more specifics. So when we're assessing a patient for contraception, we want to know their reproductive history, because some types of contraception are permanent. We want to know the reproductive wishes. Do they plan to ever have children, or are they just wanting to delay childbearing? We need to do a physical exam, or they need to have a physical exam. They may need to have some labs. We need to know their general health status. We need to assess their knowledge about reproduction, contraception, and STIs. What do they already know? Because a lot of this is education. We need to know how much their partner is able and willing to participate in decisions about contraception. There are some methods that require the partner to participate. There are other methods that the partner that can get pregnant can handle by themselves. We need to have an idea how frequently they have sex, because that may affect what type of contraceptive is best. We need to have an idea how many sexual partners they have. Are they in a monogamous relationship for the last 15 years? Or do they change partners more frequently? Or do they have several partners? And we need to assess that non-judgmentally. It's not my business. The reason I need to know is so that I can take care of that patient. We need to know if they have objections to any specific methods and what those objections are. Sometimes we might be in the position to educate a little bit about the fact that maybe those objections are based in inaccurate information. But if they object to a method, they're not going to use it consistently. We need to know how comfortable that person is with touching their genitals, because there are certain types of contraceptives that require them to handle their genitals. We need to know if there are any religious and cultural factors. What myths do they have they heard, or do they believe about contraception? Before contraception and contraceptive information was widely available, there were a lot of myths, and there really still are. There still are kids being told you can't get pregnant the first time you have sex. In the 80s, I heard about, maybe it was the 90s when I was in my 20s, but I heard about douching with sodas, with carbonated drinks. There are people who believe you can't get pregnant while you are bleeding. So what myths do they believe? Because we may be able to prevent an unwanted pregnancy by correcting those myths. And then we need to know if they're already using or have used any long-acting removable contraceptives, LARCs. So that's the basic stuff we need to assess. We're going to come back and talk about specific contraceptive methods in the next one.